Welcome to itdesk.tv. Electronic medical records have revolutionized the way healthcare professionals store and access patient information. Gone are the days of bulky paper files and ineligible handwriting, right? With electronic medical records, everything is neatly organized and easily accessible with just a few clicks. Now, these digital records contain a wealth of information about a patient's medical history, including diagnoses, medications, allergies, test results. Now, these provide a comprehensive overview of a patient's health, allowing healthcare providers to make more informed decisions about their care. Now, one of the greatest advantages of electronic medical records is the ability to share information seamlessly between different healthcare providers. Gone are the days of faxing or mailing paper records. Now, with just a few clicks, a doctor can securely send the patient's medical records to a specialist or to a hospital, ensuring continuity of care and avoiding unnecessary duplication of tests or procedures. And that's very, very important. Electronic medical records also improve patient safety. With built-in alerts and reminders, healthcare professionals can be notified of potential drug interactions or allergies, helping to prevent medication errors. Additionally, electronic records can be easily updated in real time, ensuring that healthcare providers always have the most up-to-date information at their fingertips. Now, however, electronic medical records are not without their challenges, of course. Privacy, security concerns are all at the forefront. But as you will see in a demonstration today, the Topaz EMR, Topaz Electronic Medical Record System, a system built for the physicians across the Caribbean, it is there to alleviate these concerns. Healthcare providers must ensure that patient information is protected from unauthorized access or breaches, and the Topaz EMR does all these. Now, additionally, the transition from paper to electronic records can be time-consuming and costly, requiring training and implementation of new systems. The Topaz EMR can be implemented in one day. There is a proven strategy that it uses to get doctors or physicians, facilities, hospitals on board, and you start immediately. Now, despite all the challenges out there, electronic medical records have undoubtedly transformed the healthcare industry, and they have improved efficiency, communication, and patient care with continued advancements in technology. Electronic medical records will only become more sophisticated, further enhancing the way healthcare professionals store and access patient information. Now, we're going to be doing a training now on the Topaz EMR to show you what it looks like to implement such a system and the processes involved. It's basically going to go through the process flows, and you will get a better understanding of the tool. Now, the first thing that generally happens when a person logs into a system like this, or you go to a medical facility, you will interact with a receptionist or a nurse. They'll need to know who you are. So generally you go in there and you say, for example, my name is Christopher. They'll find you if you've ever been here before, and they'll bring up your record. If you don't have a record, they couldn't find you, they'll create one for you by clicking the new button, and it will open up the system, and they'll enter your first name, last name, address, email, occupation, next of kin's information, your home telephone, work telephone, mobile telephone. They'll put your date of birth in, place of birth. The system will auto calculate your age, if you're a male or female. And if you're using a health card or you're someone who's coming in with a cash, they'll record that. And whoever you're there to see, based on what you told the receptionist right there at the front desk. You could be there for a physical examination. You could be there to see a specific doctor. However it's set up at that facility, they'll simply choose and they'll enter your record. And that is getting your information right there on the screen, which is key. They have to do that first by creating a profile. All right. The next thing they'll do after they've identified you is to place you on a waiting list. Now, like I said before, it's dependent on what the waiting list is. If you're there for a drug screening, if that was what you were there for, when you're placed on the waiting list, you'll be on a waiting list for drug screening. If you're there for multiple things, they can place you on a waiting list for multiple procedures or multiple checks. You could be there for drug screening. You could be there for medical imaging. They can put you on that list as well. So you don't start from the beginning when you're finished, for example, with the drug screening. Alright, so to do this, the system is broken down into 5 basic steps. Now, if you look with me over here, step 1 is for receptionist and nurse. So you know you'll have to find the patient. And if they're not there, you create them new. The step 1 is we'll place them on the waiting list. So we'll click that button to put them on the waiting list. Now they're there. Okay, that's it. You're on the waiting list. Step 2, they'll move immediately with that person as soon as they're ready to do what we call the basic checks. They'll do the checks based on what the person is here for. If it's a medical procedure or you're here to see a doctor, they'll probably take your height. They'll check your weight. Probably check your weight. If it's a baby, they'll probably measure the baby's head crown. For pediatric, they'll probably check your blood pressure. It's probably like any additional notes? Medical or skill. And then they'll hit the patient goes in to see a doctor and record the results, and they're finished with that. The 2 main things for the receptionist and nurse is that they'll place the person on a waiting list and they'll do the basic check, as I've already done for this patient. And the cleaner the information on this side, the better it is for the doctor. So the system is dependent on the information coming in being accurate. Okay. Now, the nurse, as soon as you put someone on a testing list, you'll have a patient list here of everyone that's on that list. So you can see pretty quickly that a Christopher Christie is currently on a waiting list for today because he shows up in the list right here that they can see at a glance. Okay. Now, when the doctor comes in, because I've only done steps 1 and 2 so far, all right. Most facilities do not check patients in unless it's a hospital. So I'm not going to do that part today. I'm going to be specific to facilities who don't necessarily check persons in, and to show you how easily you can get onto a Topaz EMR. The doctor comes in to work. The doctor starts at step 4. Whoever is working the drug screening, they'll come in and check, and they'll see that Christopher Christie is here in the lobby and he's here for drug screening, and anyone else who's here will be in this list and they'll be automatically assigned waiting number. So the doctor simply goes in, checks his waiting list, and they'll send in the patient. Now, if the doctor wants to send a message to someone, the doctor can do so as well. You could message persons, or you could message the receptionist and let them know that you're ready to begin working. So there's a messaging system over here on the right that the doctor can easily click, and he can send a message to whomever is inside the system. And he could say, and the receptionist will get the message, and the receptionist will simply send the next person in. Okay, so let's look at what the doctor sees. Step 5, patient's medical record. Now, all the information that was taken prior, their height, weight, blood pressure, temperature, they need a medical for school. The doctor now, or the physician now, has all that information available, knowing that that's the reason why this patient is here. And they can start there, all right? So, chief complaints, if there's any, they'll put, if there are any basic symptoms, a fever, headache, body pain, whatever is the doctor, based on the clinical observes, they'll fill that in here. And based on what the patient tells them, they can type it there as well. Any physical exams that the doctor does, they could type it in, or they can simply move to the buttons here, which have the basics for all clinicals that's required for medical clinicals, and getting to diagnoses, as it is currently in the medical field. So you have the history of presenting illness that could be clicked, and you can fill out this information as is required. Okay, the location, quality, severity, duration, time, and context, things of that nature. The physicians are well aware of these things. The medication history, you know, they could put information in here as they get them, as he gets it. All right. You could do review of systems, the constitutional here. And if you notice over here on the right, excessive daytime sleepiness, fatigue, fevers, if they don't want to do that much typing, they could simply come over here and check the boxes that apply in that particular order. They can also do, instead of going back to the clinical screen to click on them, allergic and immune, all right, you could just click the check boxes here. And as soon as you've clicked a checkbox, fever, you can save the information and you'll come back. Now, whatever the diagnosis is, they'll fill it in here. Whatever the procedure, they'll put here. And any treatment options, they'll also fill that stuff in, fill that information in. Okay? They can fill the information in here that's required for the glasses and the prescription. Okay? So, the optometrist, they can use this section here. The discharge note. Okay, so we'll need to have some type of scan done, or glucose test, blood test. I might recommend the blood test, and in 2 weeks, whatever they decide, and they'll save the record. Now, also inside the system, there is a prescription where if a prescription is supposed to be written, they'll simply type it in here. Okay. There's a list of prescriptions that are available in here, and you know, we can add more. Topaz EMR adds more prescriptions from time to time. As soon as you start typing, you may see the one that you require. So whatever it's used for example, you could also choose from the directions that shows up, or you could type the directions as you need. Before you do a prescription, you'll notice it says allergies, penicillin, right? So the doctor will know not to prescribe anything that has penicillin in it, because the patient is allergic to this. There is a history tab for the patient that penicillin was placed in, and could be placed there by a prior doctor. This patient is allergic to this because the patient said so. You want to keep that there, and it's always available. Anyone who goes into the record will be able to see that this patient is allergic to penicillin, so they won't prescribe anything. And this is what the system looks like for a doctor. The doctor basically then, when a doctor comes in, a physician, they basically live at steps 4 and 5. They simply check their list, whichever list they're working, simply choose who they want to work with at the time, do the clinical, and from step 4 go into step 5 and do their processing. It's interesting to note all the prior records that were done is available in the system. Now, nothing was placed for this record January 8th, but if you go on the documents, which was key, you can see that this person had pain to their left side, and it was taken here through the system. So the question is, can you have a chart that if you have a writing type input device that you could use instead of doing typing all the way through? And the answer is yes. There is a writing pad that's on the system where it brings up the human silhouette, front, back, and side. And you could use this tool over here. You could change the colors. For example, I'm using the black one here to indicate. Now I'm just using my mouse real quick, and I could change the color to red. And do whatever is required. And when I'm finished, I just save right on the chart. Alright, and when I'm done, I just hit save. It's now saved. Now, I could disable the writing pad. Now, on the docs, whenever someone comes in, they'll see the document. And I could have multiple documents. I only have one for these, but on this record on the 13th, I have a lot of records that I added to this. Okay, and if you have information that came in from a lab for the patient, you could add it to the record so that the doctor comes in and they'll be able to see it from in here. Okay. Now, what's the next step on the system? Now, it will come down to how does the receptionist know how much it is to collect from the patient if they're the ones collecting the fees, using the health cards and things of that nature. The practitioner can access the invoice screen for the patient from here. Okay. As many charges as is necessary. Physical assessment. And so the patient will owe this. So the doctor added this. Okay, let me show you. And that was it. Now when the patient goes around to the front, back to the receptionist or back to the nurse, and the nurse simply brings them out, or you tell the patient, go to that person. The nurse simply clicks on the patient and it takes them in here. And the nurse or the receptionist will see the charge that the physician placed on there. Now it doesn't have to be the physician who places a charge, but the physician can also put the charge onto the patient's profile. The nurse can come in here though as well and put the charge on if one is required. So both can do it, but the nurse is the one, or the receptionist at the front would be the one who collects the payment. So off this $22,000 here, the payments can be collected. How much did this person pay? Did they use cash for $5,000? And they use insurance for the insurance covered $18,000, and the insurance was whichever insurance company that they have. It can be placed in here, okay, in a drop-down list, and those companies will show up. Okay. In the meantime, let's just say it was popular ones. you know, and it was for drug screening. Just, all right, see? So it's patient page, and that's basically it. All right, and you monitor it from here. At the end of the day, there are multiple reports that can be run. And so let's do one for what we call a validation report, where you're able to check off what was done on the day and by whom. You'll know who collected it based on their login. So everyone in the system has to have their own login, so that the person who's working the point of sale or the person who's working at the receptionist, they'll have their own login, so you'll know everything that they did and what they collected, so you could check them off at the end. There is a plethora of detail and information processes that can be run right there inside the Topaz EMR. And that is just some of them that I've gone through. But this is the basics of it. Nurses and receptionists, they'll do steps 1 and 2. Doctors and practitioners will work in steps 4 and 5. And all the receptionist does at the front is to make sure the records are accurate. And when it comes time for them to upload a record for someone, for example, want to upload a record for Christopher so that the doctor is able to see it, they'll go into the documents and they'll simply upload documents and grab it from wherever the document is stored. And that will take care of it. Okay? That will take care. Let me grab the lab report. It doesn't matter what it is. Alright. I'm going to go back home and I'm going to go into his medical record. I'm going to go to docs as a doctor who didn't know all that and click on it. And there it is. It's available inside the record based on what you added it for. Now this is the Topaz EMR, the Topaz Electronic Medical Record System for the Caribbean practitioner. It was built for the Caribbean by persons who are from the Caribbean, and it's available now at topazemr.com. Get yourself a Topaz as we move toward the future. itdesk.tv, unlocking doors.